Microneedling is a technique that has been used for probably decades now, and it's a technique in which we use microneedles to create controlled injury to the skin. This is an attempt to stimulate collagen and form a little bit of resurfacing to the skin. The most primitive device that was used for microneedling previously was a dermal roller. Basically, this is a circular device where you roll needles on the skin to create the injury to the skin. I generally wouldn't recommend using a dermal roller these days for a few reasons, and one of the main reasons is infection control. Because sterilization of these dermal rollers, if you use multiple times, tends to be poor, and you risk introducing a lot of infection into the skin. Also, because of the nature of the dermal roller, because it's circular, needles go into the skin at different angles, and you do not have precise control on the depth of the microneedling. And of course, these dermal rollers tend to be inferior to the kind of microneedling devices we have in the clinic these days in terms of both sterility, in terms of precision and control. We also introduce radiofrequency into the skin to stimulate even more resurfacing and collagen production.